Welcome to the ACC 2012 in Chicago. I am Dr. Kenneth Ellenbogen from the VCU School of Medicine in Richmond, Virginia. It is my pleasure to be interviewing Dr. Michele Bernoulli. Dr. Bernoulli is Chief of Cardiology at the Hospital of Tugullio in Lavagna from Genoa, Italy. And it's my pleasure to be with Dr. Bernoulli, who will be presenting a late-breaking clinical trial. Dr. Bernoulli, please tell us a little bit about the clinical problem this late-breaking clinical trial addresses.
The efficacy of pacing therapy in patients with reflex syncope has been questioned recently after two randomized double-blind clinical trials failed to show a benefit of pacemaker compared to placebo. We hypothesized that the reason of this failure was that the patients were unselected. So we thought that if we were able to select the patient according to the mechanism of syncope and precisely to select those patients who have a pause, an asystole at time of syncope, pacemaker would be helpful, because it is obvious that if pacing may be efficacious when asystole is the mechanism of syncope, by sure it cannot be effective when an hypotension, a non-asystolic arrhythmia is present. So we decided to perform the ISSUE-3 trial, which consists in a screening phase during which we implanted an implantable loop recorder in order to detect a document with HEG a spontaneous events, and when the mechanism was a pause, precisely a syncope with a pause of 3 seconds or non-syncopal pause more than 6 seconds, we decided the patient were eligible to a randomized trial.
So, very clear study design to try to answer definitively the question about the role of cardiac pacing in patients with neurocardiogenic syncope or reflex syncope with a prominent bradycardia component. Tell us a little bit about the number of patients you screened and the number of patients who were enrolled in the trial, and we understand what the study design is. Tell us a little bit about the patient population.
Exactly. First of all, I have to say that the clinical features of the patient were very well defined, because these were a selected population based on the fact that not all the patients with reflex syncope could be recruited, but we required that the patients were older than 40 years, that had recurrent unpredictable syncope. Unpredictable means no warnings. So high risk of trauma, high frequency of episodes. Then we, in this patient that we estimated represent 9% of all reflex syncope patients referred to a specialist clinic, received an implantable recorder, and we waited until a syncopal event recurrent could be documented. 511 patients received a loop recorder, and after average follow-up of 12 months, 89 of these were eligible for the randomized trial. This means they had an asystolic event. 79 of these were finally randomized, pacemaker on versus pacemaker off.
So tell me, what were the results of the clinical trial?
The result was that pacemaker was more effective than placebo in reducing the recurrence rate of syncope. And in particularly, we had, after 2 years, 25% recurrence rate in the pacemaker arm versus 57% recurrence rate in the placebo arm, which means a 32% absolute reduction of recurrent syncope and 57% relative risk. In other words, a number needed to treat of 3.
Very powerful results. If you could, there are many practicing clinical cardiologists who see patients with recurrent syncope. Will you give us the take-home message from this clinical trial, how they should manage those patients based on the results of this important trial?
I think that this study definitely shows that pacemaker can be effective in patient reflex syncope. The fact that pacemaker is effective does not mean that all patients with reflex syncope need a pacemaker. Only a minority need a pacemaker, and these are to be selected according to the clinical feature. As I already mentioned, the ISSUE-3 population is characterized by old age, recurrent syncope, unpredictability, long pauses.
Thank you very much, Dr. Bernoulli. That was an excellent summary of this important late-breaking clinical trial, which has implications for some of our patients with recurrent reflex syncope. Thank you.